Good morning, students. Welcome to my video lecture on anatomy of nasal cavity and nasal septum. Nasal cavity and nasal septum, you will find this topic in the textbook under the chapter the nose and paranasal sinuses. So that is a broad chapter. So that is why I divided the important topics related to that chapter in two separate video lectures. In this video lecture, we are going to discuss about nasal cavity and nasal septum. And in next video session, we will discuss about the lateral wall of nose and paranasal sinuses. So let's start with the nasal cavity and nasal septum. Now, before discussing or before telling you the skeletal framework of the nose, first of all, what is nose? We know that nose performs two functions. First of all, it is a respiratory passage, as we all know. It is a respiratory passage, and second, it has a very important function that is sense of smell. So that sense of smell is the main sensory function of the nose. So nose has two functions. One is respiratory function and the second one is the sense of smell. That is, nose is the organ of the smell, and the receptors of the sense of smell are placed in the upper one third where I'm moving my cursor. So upper one third of the nasal cavity. So, upper one third of the nasal cavity is covered by basically olfactory mucosa and is responsible for the sense of smell, whereas the lower two third of the nasal cavity is nothing but the respiratory passage and is lined by respiratory mucosa. Now, for descriptive purposes or you can say theoretically, nose is divided into two main parts: the external nose and the internal nasal cavity. Okay, so here I will define the skeletal framework of the external nose. Okay, the external nose has a skeletal framework which is partly made up of bones and partly made up of cartilages. The bones are the nasal bone, as you can see in this figure. The nasal bone, which basically forms the bridge of the nose. This is called the bridge of the nose. This is the root of the nose. Towards glabella is the root of the nose, and towards ala nasi or ala of the nose is the tip. Okay, in the video lecture of face, I already told you about the ala of the nose, the external nose. Some features of the external nose have been described already in that video lecture. Now, moving forwards and discussing about the skeletal framework of nose. So skeletal framework of nose consists of bones as well as cartilage, and the bones that composes the nose or that makes the framework, bony framework of the nose, are the nasal bone. Okay, that forms the bridge of the nose, and the frontal process, of the maxilla, frontal process of the maxilla. So the frontal process of the maxilla and the nasal bone, frontal process of the maxilla is not labeled here. So the frontal process of the maxilla and the nasal bone forms the bony framework of the nose, whereas the superior nasal cartilage and the inferior nasal cartilage along with the septal cartilage, okay, the superior nasal cartilage, the inferior nasal cartilage and the septal cartilage will form the cartilaginous framework of the external nose. Now, what is nasal cavity? So, to define nasal cavity extends from the external nares or nostrils, to the posterior nasal apertures. Okay, from external nostril to the posterior nasal apertures, this hole is the nasal cavity where I am moving my cursor. This hole is the nasal cavity, and this nasal cavity is basically divided into right and left half by a nasal septum. Okay, by a median septum that is called as nasal septum, which divides this nasal cavity into right nasal cavity and left nasal cavity. Each half of the nasal cavity has a floor has a floor a roof, and a medial and lateral wall. This is the lateral wall. What you are seeing is the lateral wall consisting of the concha and the metatarsus. So this is the lateral wall. I've already told you that we'll go in details of the lateral wall of nose in the forthcoming video lecture. Now, leaving the lateral wall, I defined the boundaries of this nasal cavity as that each nasal cavity has a roof, a floor, a lateral wall which is visible in this figure. This is the lateral wall, and the median wall. Median wall is nothing but the nasal septum, which is common for both the sides of the nasal cavity. That is, the medial wall, the nasal septum, one side of the nasal septum forms the medial wall to the right nasal cavity, and one side of the nasal septum will form the medial wall for the left nasal cavity. Okay, so the medial wall is common, that is the nasal septum, and the lateral wall is also having the similar structure or similar anatomical framework. And even the roof and the floor means I'm just telling you that the boundaries of the nasal cavities, or the roof and the floor, as well as the lateral and the medial wall of the nasal cavity, are same for each side or both the side. Now each half measures around 5 centimeter in the height. This is height. Okay, height means the distance between the roof and the floor, so it is around approximately 5 centimeters in height, and length from the anterior nasal aperture to the posterior nasal aperture is around 5 to 7 centimeters. This is the length, and 1.5 centimeter width basically near the floor. So the width is around 1.5 centimeters. Now the width near the roof, as you can see, the width near the roof is very small, that is around 1 to 2 millimeters only. Now the roof, first of all we'll discuss about the roof. So this is the roof of the nasal cavity, which is around 7 centimeters long. Yes, you can see this roof is around 7 centimeters long, and it slopes downwards to both the sides. Yes, it is sloping downwards anteriorly as well as it is sloping downwards posteriorly. This is the roof of the nasal cavity, which is around 7 centimeters in length, and width is around 2 millimeters. The width is around 2 millimeters. The middle horizontal part, the middle horizontal part of the roof of nasal cavity is formed by the cribriform plate of the ethmoid bone. Okay, of the ethmoid. So this is the cribriform plate of the ethmoid bone, which forms the horizontal part of the roof of nasal cavity. And the anterior slope, yes, you can trace the anterior slope is formed by the nasal part of the frontal bone. Okay, the nasal part of the frontal bone, then the nasal bone, this is the nasal part of the frontal bone, this is the nasal bone, and then the cartilages, the nasal cartilages, the superior and the inferior nasal cartilages. So this will form the anterior slope of the roof of the nasal cavity. Now talking about the floor of the nasal cavity. So the floor of the nasal cavity is around 5 centimeter long, or is around 5 centimeter in length, and 1.5 centimeter in width. Okay, and it is basically formed by the palatine process of the maxilla. This is the palatine process of the maxilla. Yes, the palatine process of the maxilla, and the horizontal plate of the palatine bone. This is the horizontal plate of the palatine bone. So these two bones will form the floor of the nasal cavity, and you can see from side to side it is basically concave in shape from side to side. Yes, it is concave in shape from side to side, and you can also see that it is slightly higher anteriorly than posteriorly. Anteriorly it is slightly higher than posteriorly. Now, what is nasal septum? Nasal septum, as I have already told you, is the median partition between the two halves of the nasal cavity. Yes, so this is the median partition of the two halves of the nasal cavity, and this median partition is again, as we already discussed, the skeletal framework of the external nose. Similarly, this nasal septum also is osseo-cartilaginous. That means it has a bony part and the cartilaginous part. Okay, so the nasal septum is the median. You can define nasal septum as the median osseo-cartilaginous partition between the two halves of the nasal cavity, and on each side of this nasal septum it is basically covered by mucous membrane. On each side means on right side or left side, it is covered by the mucous membrane, and it is forming the median wall of both the nasal cavities. Yes, I have already told you that the nasal septum is basically the common medial wall of both the nasal cavities. Okay, so the bony part, first of all we will define the bony part of the nasal cavity. So the bony part is basically formed by two very important bones. First one is the vomer. This is the vomer. So the vomer and the perpendicular plate of the ethmoid. This is the perpendicular plate of the ethmoid. So the vomer and the perpendicular plate of the ethmoid is forming the bony part of the nasal septum, and this bony part is also supported, or it also receives some margins of some other bones. That is, you can see in this figure that the nasal spine of the frontal bone, this is the nasal spine of the frontal bone, which is attached to the perpendicular plate of the ethmoid. Then we also have the cribriform plate of the ethmoid. We have the rostrum of the sphenoid. Yes, the rostrum of the sphenoid. And we have the nasal crest of the nasal bone. So these are some other bones whose margins are attached to these two basic bones, which forms the bony skeletal framework of the nasal septum, the perpendicular plate of the ethmoid and the vomer. Now talking about the cartilaginous part, which is basically formed by the septal cartilage, the larger one, the main cartilage is the septal cartilage, and the second one is the septal process of the inferior nasal cartilage. This is the septal process of the inferior nasal cartilage. So these two cartilages is forming the cartilaginous part of the nasal septum. Now the cuticular part, that means the part covered under the skin, the cuticular part, this is the cuticular part of the nasal septum, or you can say the lower end of the nasal septum, which is formed by the fibrofatty tissues and is covered by skin. That is why it is called as cuticular part, and its name is columella. Columella is the lower part or the cuticular part of the nasal septum, which is covered by the skin. Sorry, going back to the previous slide. Yes, so now this nasal septum, as I have already told you, is the median partition, but in majority of the subjects or in majority of people, this nasal septum is not placed medially but is slightly deviated to one or the other side, and this deflection is called as deviated nasal septum, DNS, which will be discussed in the forthcoming slides of clinical anatomy. Now, so this nasal septum has the four borders. So the four borders: the superior border, the inferior border, the anterior border, and the posterior border. So these are the four borders of the nasal septum, and it has two surfaces, the right one and the left one. Okay, the right surface forming the medial wall of the right nasal cavity, and the left surface forming the median wall for the left nasal cavity. Now talking about arterial supply of the nasal septum. So anterosuperior, this is the anterosuperior part of the nasal septum, which is basically supplied by the anterior ethmoidal artery. This is the anterior ethmoidal artery, yes, and this supplies the anterosuperior part of the nasal septum. The posterior-inferior, this is the posterior-inferior part and is supplied by the sphenopalatine artery. This is sphenopalatine artery, which is supplying the posterior-inferior part of the nasal septum. Now the antero-inferior part, this is the antero-inferior part of the nasal septum, which is supplied by the superior labial branch of the facial artery. Okay, this is the superior labial branch of the facial artery, which is supplying the antero-inferior part of the nasal septum. and the posterior-superior part. This is the posterior-superior part of the nasal septum, which is supplied by the posterior ethmoidal artery. So this is the posterior ethmoidal artery supplying the posterior-superior part of the nasal septum. Now you can see here it is marked as Cassel-Bax plexus. In 2 marks question, it is frequently asked what is Cassel-Bax plexus, what is Little's area. So this Cassel-Bax plexus is a plexus of arteries which is found in the antero-inferior part or the vestibule of the nasal septum, and it is formed by anastomosis of the superior labial branch of the facial artery. Yes, you can see here. Then the sphenopalatine artery, and the anterior ethmoidal artery. So anterior ethmoidal artery is sphenopalatine artery, and the superior labial branch from the facial artery forms an anastomosis within the antero-inferior part of the nasal septum, and this anastomosis or this plexus is called as Cassel-Bax plexus, and this Cassel-Bax plexus is basically responsible for the bleeding from the nose or epistaxis. Epistaxis means bleeding from the nose, and this is the commonest site where this Cassel-Bax plexus is there, and this area is known as Little's area. Little's area. So Little's area is the commonest site of bleeding for epistaxis. Now, talking about the venous drainage of nasal septum. So venous drainage will be through the plexus, which is very dense in the antero-inferior which is very dense in the antero-inferior part or the Little's area. Yes, and or you can say this area, the anterior-inferior part of the nasal septum or the Little's area. So this area is very dense in the venous plexus, and this plexus basically the venous blood from this plexus will drain to the facial vein anteriorly. So the anterior part of the nasal septum will drain into venous blood into the facial vein anteriorly, and will drain the posterior part of the nasal septum will drain venous blood posteriorly into the pterygoid plexus. Okay, and the sphenopalatine vein, here it is not labeled, sphenopalatine vein is not labeled. So the sphenopalatine vein is draining the posterior part of the nasal septum and is finally draining it into the pterygoid plexus of veins. Talking about nerve supply of nasal septum, so the nerve supply is divided into general sensory nerves, and the special sensory nerves. These are the special sensory nerves, the olfactory rootlets. Now, talking about the general sensory nerves, so general sensory nerves basically arises from the trigeminal. General sensory nerve basically arises from the trigeminal nerve and the anterosuperior part. This is the anterosuperior part of the nasal septum, which is supplied by anterior ethmoidal nerve. This is the anterior ethmoidal nerve, and this is the internal nasal branch. This is the internal nasal branch of the anterior ethmoidal nerve, which is supplying the anterosuperior part of the nasal septum. The posterior-inferior part is supplied by the nasopalatine branch from the pterygopalatine ganglion. So this nasopalatine nerve or the nasopalatine branch arises from the pterygopalatine ganglion and is supplying the posterior-inferior part of the nasal septum. Talking about posterior-superior part of the nasal septum, so posterior-superior part is supplied by the medial posterior superior nasal branches, which is also arising from the pterygopalatine ganglion. So the posterior part is supplied by the pterygopalatine ganglion, the nasopalatine branch from the pterygopalatine ganglion, and the medial posterior superior nasal branch from the pterygopalatine ganglion is supplying the posterior part of the nasal septum, whereas the anterior part is supplied by the anterior ethmoidal nerve. Talking about the special sensory nerves or olfactory rootlets, so these are the nerves which is confined to the upper part or the olfactory area of the nasal cavity. This is the olfactory area of the nasal cavity, and these are the olfactory rootlets or the olfactory nerves, which are basically special sensory nerves found in the olfactory area of the nasal cavity. Now, talking about lymphatic drainage, and so anterior half of the nasal cavity will drain its lymph into the submandibular lymph nodes. Okay, these are the submandibular lymph nodes below the mandible, and the anterior half of the nasal cavity, nasal septum will drain its lymph into these submandibular lymph nodes. The posterior half of the nasal septum will drain its lymph into the deep cervical lymph nodes. These are the deep cervical lymph nodes, and deep cervical lymph nodes will receive the lymph from the posterior half of the nasal septum. Okay, so submandibular lymph nodes and deep cervical lymph nodes are the lymph nodes which drains lymph from the nasal septum. Now, talking about clinical anatomy of external nose and the nasal cavity or nasal septum. So, CSF rhinorrhea, cerebrospinal fluid rhinorrhea. Cerebrospinal fluid rhinorrhea will be caused if in case there is a fracture in the roof of the nasal cavity. The roof is formed by the cribriform plate of the ethmoid bone. Yes, so if the roof due to any injury or trauma, if the roof or the cribriform plate of the ethmoid bone is fractured, causing damages to the olfactory nerve or the olfactory rootlets, then or as well as causing damage to the meninges of the brain, then there will be leakage of the cerebrospinal fluid from the nostrils, which is called as CSF rhinorrhea. This condition will be caused due to trauma or injury leading to the fracture of the cribriform plate of the ethmoid bone. Now, deviated nasal septum, as I have already discussed or defined you, that the nasal septum is generally the median partition between the two nostrils. But you can see in the figure that this subject or this person is having right-sided DNS, deviated nasal septum. So this deviated nasal septum can be deviated to right or left side or either side, and wherever it will deviate, it will cause the it will cause irritations, or it will cause the inflammation or swelling or overgrowth of the surrounding nasal mucosa, and making breathing difficult, as well as make sometimes it hinders the sense of smell too. So this deviated nasal septum will cause frequent infections, frequent problems, or you can say frequent irritation to the nasal mucosa, and it causes irritation to that side of nasal mucosa to which it is deviated. So here you can see these are the concaves, and these concaves are in close contact with this nasal septum, making the passage very narrow. So this narrow passage will lead to blockage of the nostrils, frequent blockage of the nostrils, or there may be excessive mucus discharge from the nostril from that nostril towards which the nasal septum is deviated. So deviated nasal septum is very common, and in more or less 80% of the subject, the nasal septum is deviated to one side. If it is deviated more than normally, then it will cause symptoms like blockage of the nostrils or rhinorrhea, rhinitis, etc., etc. And epistaxis, yes, we have already discussed about the littles area. So the littles area on the end, which is the area having the Kiesel-Bax plexus on the antero-inferior part of the nasal septum, and this area is The commonest site of bleeding from the nose, which occurs due to the damaged blood vessels, and this bleeding from the nose is called as epistaxis. So that is all for the nasal cavity and nasal septum. In next video lecture, we will start with the lateral wall of nose and the paranasal sinuses, and will complete the nose and the paranasal sinuses. Till then, stay home, stay healthy, take care. Thank you so much.